My name is Christopher Thompson. I'm the medical director at Aspire Allergy and Sinus.
Dr. Thompson, we always hear that Austin is one of the worst cities for allergies. What makes the fall season here so much tougher?
So our problem is that we've got such a long growing season. Grass allergies start in the early summer, and for us, they go all the way to September. And then, of course, ragweed gets ramped up in August and goes all the way to November. So we got that crossover, just getting constantly hit by those two things.
Now, for someone who is always sneezing or has congestion in the fall, how do they know it's just seasonal allergies and not something more serious?
So it can be really confusing because a cold and allergies can be quite similar, but you're typically not going to have a real sore throat or fever when it's allergies. You're going to be stuffy. You're going to have a runny, itchy nose. You might sneeze. Your eyes might get irritated. You might even get a cough, but typically you're not going to get that sore throat, scratchy throat, fever that you might associate with flu or a cold.
And a lot of people think allergies are just an annoyance, runny nose, itchy eyes, but you say they can actually cause inflammation throughout the body. Explain a little bit.
Yeah, it is kind of surprising. There's so much news out there about aging and inflammation, and allergies, airborne allergies, are kind of one of the most common forms of inflammation in our bodies. Now, if you've got allergies once a year, it's probably not a huge issue. But if you're one of those people who suffers throughout the year, every time you're experiencing allergy symptoms, there are inflammatory chemicals that are kind of running through your body to alert your systems that there's something bad going on. Of course, there isn't. Our immune systems are misinterpreting these allergies, but nonetheless, it triggers this response that we have, almost like we're responding to an infection or something. And so if you've got this on a daily basis throughout the year, you're experiencing systemic inflammation, and the studies now show that links closely to aging.
Dr. Thompson, what are some of the other health issues that can be linked to constant inflammation or allergies? What comes to mind for me is brain fog, just exhaustion.
Yeah, well, that's one of them. And there's a lot of studies out there that show children and their test scores suffering if they're taking tests during allergy season. So it really hits everyone, but it's really notable in kids going to school who have this. Also, young kids who have bad allergies are probably twice as likely to develop asthma if they don't get treated. So that's one of the most devastating consequences of allergies, that it can lead to asthma. And then the other commonly associated problems are sinus infections, are often triggered by allergies. And then sleep. It's hard to sleep if your nose is stuffy. And then finally, asthma in adults and children is typically triggered by allergies. So all of that stuff kind of gets exacerbated by allergies. Allergies are often minimized, I think, especially for people who don't have allergies. They don't really understand the extent to which you suffer when you have allergies. So yeah, it really gets downplayed because it's not life-threatening, right? It's kind of like a quality of life issue, so it doesn't get as much airtime as more severe diseases like diabetes or metabolic disorder. But it's definitely a chronic illness that kind of drags people of all ages down.
Many people pop antihistamines like Zyrtec or Claritin every day. What is the downside of relying on the over-the-counter medications instead of treating the root cause?
You're exactly right. It's a Band-Aid. I don't think any of us are fans of daily use of those medications, but that's what most people go to. They pop an Allegra or a Zyrtec, and it's a Band-Aid. It fixes you temporarily, and it typically only takes care of a portion of the symptoms. So most people don't get complete relief. So you're still kind of suffering. You're just not suffering as bad, but you got to do it every day that you're having the symptoms.
And if you would, explain and talk a little bit about allergen immunotherapy. Is it a long-term fix, or how does it actually work to retrain your immune system?
Yeah, so surprisingly, there are very few people that are doing this. Less than 2% of the population who have allergies end up on this. And a lot of it is just people don't understand it. But it's pretty simple, and it's been around for over a century. All it is really is we're delivering what you're allergic to on a regular basis. So let's say you're allergic to ragweed pollen. Well, when you get ragweed in your nose periodically through the year and you're allergic to it, it really irritates you. But if we give it to you every day or once a week in the form of allergy drops or allergy shots, your immune system begins to kind of acclimate to it. As it sees that steady dose that actually increases over the course of the first year, your immune system starts to begin to tolerate and see it as, no longer a problem when it gets exposed. So that first year of allergy therapy, as we ramp up the dose, and again, we're just providing what you're allergic to. There's no pharmaceuticals involved here. If you're allergic to cedar, you're getting cedar pollen, and we can give that under the tongue, or you can come in daily for a shot. That's how allergy therapy works. And then typically you have to do that for a number of years for it to be permanent. So that first year ramps you up, but it doesn't provide permanent relief until you get to about year 5 in most cases.
And if someone starts allergy treatment now, will it help them for the fall season, or is it more of a long-term investment?
Yeah, so there's 3 forms of allergy therapy out there now. The shots have been around, like I said, for over a century. Actually, allergy drops have been around nearly as long. And then a newer method that's probably been around for 20, 25 years is where we put these allergy serums directly into a lymph node, which instead of taking 5 years, it typically takes about 2 months, 3 months to get you relief. So it's a new form of therapy, but it's the same method. We're giving the same stuff. It's just a different route of entry into the body. In regard to how quickly this stuff works, if you get on allergy drops or shots, it usually takes you 6 to 9 months to get some relief. So it's hard to fix people right away without using other medications. With this newer form called Exact, we usually can get you well within about 3 months. So it's faster acting.
And let's talk about lifestyle. What lifestyle changes can people make during the fall to help reduce their exposure and inflammation?
Yeah, so the best 2 things you can do are also pretty obvious when you think about it. One is if you've been out all day long and you come home, you don't want to stay in that clothing and you want to take a shower because that ragweed, those particles are in your hair, they're on your skin, they're on your shirt and pants. So you want to get rid of that right away so you're not constantly exposed to it all evening long after you get home. So that's a pretty easy fix, is to wash your hair, shower, throw the clothes in the laundry. And then additionally, if you do a sinus irrigation with salt water, that cleans the nose out because, again, those particles are sitting in the little hairs on your nose, and they're just constantly going to bother you while they're there. So if you can wash that stuff out after you get home, you're really doing yourself a service.
As you're talking about that, your hair, your clothing, take a shower, we forget about our pets, our dogs. They could be a problem too.
It sure can. Yeah. Yeah, it sticks well to pets and hair and clothing.
So let's talk about solutions. If a listener wants to get off that merry-go-round of over-the-counter allergy medications, what's the first step they should take?
So the first thing that we need to know is what you're allergic to and how severely you are allergic to it, because we want to target the therapy. Everybody gets kind of a different sort of therapy based on that test. So if you come in and you're allergic to cedar, ragweed, and grass, we don't want to give you cat dander serums. We want to target those 3 things. And once we know what you're allergic to, we can create that serum, and we then work together to decide what's the best delivery system for you. If you're somebody who has time to come by once a week and get an allergy shot, then and like that scheduling rigidity, which a lot of people like, then that's a great way forward. We have a lot of patients who are constantly on the go, and many of our children are going to opt for the allergy drops because you don't have to come in. You do it every day instead of once a week, but you do it at home. So it gets pretty convenient, easy to work into your schedule. So that's the next step, is deciding what's the best method. And then the third and the most important part is being regular with it and following the course, because we have a lot of patients, they invest a year, get better, and then feel like they don't need it anymore. And then usually a year or two later, they're back, symptoms have returned, and that whole year was wasted. So I think it's really important to understand how it works so you get a good long-term fix.
And so I guess the first step is to schedule a visit at Aspire Allergy and Sinus. The website is aspireallergy.com, and you could schedule a visit on their website very easily. And then when you get there, you will take a test.
Yeah, that's right. You come in, you get tested. You know instantly what you're allergic to, and you have the treatment plan already rolling before you walk out of here.
Dr. Chris Thompson, Aspire Allergy and Sinus, thank you for the visit today.
Yeah, it's great talking with you, Todd. Thank you.